and Healthcare podcast. I'm Noah Vandal.
I'm Joseph Yoon.
And we're glad to have you here. We're starting this podcast, and we'll give a quick, brief intro into why we have a passion for healthcare and machine learning. For myself, I've been working in machine learning for over 5 years, and I've always been interested in healthcare. Growing up, always wanted to be a doctor and ended up going to school for engineering. But I got into machine learning back in 2020, 2021 is when I really started getting into it. And ever since then, I've kind of fallen in love with machine learning and AI. And still, though, had the passion for healthcare use cases. And so more recently was able to get the opportunity to start a company working with healthcare AI with Dr. Yoon. And it's been an absolute blast.
I'm Joseph Yoon, and I'm a practicing physician, mainly work in hospital setting. I have a background in health informatics, and back in my fellowship days, people did work on AI, but it was not as good as now. In fact, it was not very hot topic at the time.
No.
Yeah, so we did. There was people who were attempting applying neural network on health information system, but the outcome was not very good.
Sure.
But for me, everything changed with ChatGPT 3.5.
Oh, really? Okay.
Yeah, and I think that's when I
Watershed
saw
moment.
real potential to be applied in healthcare system to make things better and more efficient.
Sure.
And of course, at reduced cost.
Right. Awesome. Well, that's actually the topic that I have questions for you about today.
Mm-hmm.
Specifically is around healthcare costs. Because, as anyone knows, healthcare in the USA is not cheap.
Yep.
And I think you were telling me you pay close to $2,000 a month just for insurance. And
Yes.
you have your wife and a son.
Yep.
Yeah.
Yeah, three of us pay about $1,800 per month.
Yeah. So the one thing that I think is crazy is, like, for myself, I thankfully I've been pretty healthy. I haven't had to go to the hospital too much. But when I have gone, a lot of times the first question that I have thought, and I know a lot of other people think, is when you ask, how much will this cost me? Oftentimes it's so hard for them to give a good answer. So why is that?
Yeah, in the U.S., I think we have more complex healthcare system than other countries.
Okay. Sure.
And that's a big part of why we can't really find out what it costs. And
sure.
also, I think traditionally in the U.S., the finding out pricing for healthcare has been hushed.
Really?
Because you want your healthcare provider to be blinded to the cost.
I see. Just doing whatever's best.
Yeah, I think that has served a great purpose of discriminating patients based on their ability to pay.
Oh, sure.
So I
sure.
can
Which is
attest,
good, right?
Yeah, which is good. I can attest that when I work in the hospitals, whether the patient's ability to pay or financial status doesn't come into the picture in decision making at all, unless it is the co-payment that they have a hard time with. Then I have to think about which medication is on the formulary of their insurance plan and makes it cheaper versus other medications that are not covered. So in that situation, yes, the cost consideration do come in. But otherwise, in terms of a treatment, we are blinded to patients' ability to pay.
Interesting. Well, it's still though unfortunate, though, because I feel like prices have just gone up, and it's like, services being rendered haven't changed a whole lot.
Right.
Seems like that.
Yeah. So I think on the flip side of that equation is that because it is difficult to find what it's going to cost. It's and as the price of medical care has gone up quite a bit, the healthcare choice making becomes very difficult, and sometimes many patients are surprised by big bill at the end.
Right, right.
And so I think now a lot of people are waking up to the fact that yes, we do need price transparency
Yeah.
for anyone to make informed decisions about their treatment.
Which is kind of unfortunate, but I feel like the incentive model has been slightly misaligned, you know, and so it's almost like a necessary evil, right?
Yep. And I think one laudable initiative from this administration was making a hospital charge transparent in their pricing.
Oh, really?
Yeah,
that's good.
It has to be published now. People can find out what's going to cost.
Well, like you said, I mean, if you need treatment, you need treatment.
Mm-hmm.
You don't care about the cost. But I mean, there's a lot of things where maybe it's not elective, but you might choose options like Avera versus Stanford, right?
Yeah.
For us here.
Well,
You know.
or sometimes, let's say, you know, you have a low back pain.
Right.
From my perspective, from a physician's perspective, MRI often, majority of time, MRI doesn't add to the care.
Really?
Yeah.
Simple X-ray suffices, or
Right.
nothing
X-ray
even.
could do, and often initially, if there is no warning signs, red flag signs, then trying out the conservative treatment works
Sure.
out the majority of the time. So then, but when we do MRI, oftentimes it's not giving us a lot of information.
Sure.
Just high cost. So if if the patient is
Well-
paying out of pocket, then in decision making, if the patient knew the cost, how much he's going to pay,
Right.
then with that we can perhaps discuss. Okay, is it really worth it? Do you really want to pay $200 copayment
Right.
for your MRI versus $50 X-ray? Given your symptoms, maybe X-ray will do. Give us enough information.
That makes sense. I suppose too, like there's an emotional component I feel attached to healthcare.
Right.
Like I want the best, but it's like, well, realistically, this is going to be enough.
Yes, but the best is not always the best. So let's say the CAT scan is done,
Okay.
right,
Uh-huh.
for stomach ache. Well, oftentimes a stomach ache, if it is especially if there is let's say viral, virus-induced stomach problem, then it's gonna resolve on its own. You don't need the specific symptoms, but I want the best care, quote unquote,
Right,
and
right.
so let's get CAT scan. So we got the CAT scan. Then what sometimes happens is we have incidental findings,
Interesting.
such as let's say there is something in the kidney.
Mm-hmm.
Oh, what is it? It could be a cancer. So then a person then gets the biopsy, and the biopsy can have a complication, bleeding complication, and sometimes it could be very serious.
Right.
So there is because nothing is 100% accurate. There's always false positive and false negative findings in any diagnostic measures. So when you have a certain level of suspicion, then the testing makes sense. Versus if you have a very low suspicion, then testing often can give you false positive findings that can lead to more complications.
In machine learning, I remember I learned, you're dealing all the time with false positives, false negatives. Mm-hmm. I remember learning it specifically with medical data sets. It's oftentimes worse to have a false positive than to have a false negative. Just because you can then, instigate a bunch of unnecessary medical procedures that could leave you way worse than to begin with.
Yes.
So question for you. So then if I was like, I had a health condition or something, I had to go to the hospital, what should I do or just be aware about to kind of know what the pricing may be up front? Is there any sort of due diligence I can do as a consumer or a patient?
So for emergency, probably not.
Okay. Well, right. Yeah.
If you have, if you're having a heart attack, I would not recommend shopping for different. But for non-acute conditions, yes, I suppose you can compare the price, especially if you are shopping with private pay. Without So let's say LASIK surgery for your eyes. Usually they're not covered by insurance.
Right.
So then you can really compare which eye center offers what procedure at what price. And you have time to do that.
Sure.
In case of other than that, it's very difficult because different insurance plan will have a different pricing and there are a lot of different procedures to know. And so that's why I think if we can use artificial intelligence to kind of survey and sift through the huge database, and AI is really good at finding specific information in the sea of database, and also AI is good at analyzing and picking out the most optimal answer.
Yeah, right.
So
you say we don't have to memorize all the CPT codes.
Well, exactly. So AI is so good at it. So I think that's one way AI can really help consumers of a healthcare system.
Sure. Well, I guess that was my last question. So, how do you foresee or how could AI help patients with specifically estimating costs before, if they have something that they are thinking about undergoing, like a procedure or something?
Yeah. Even as the physician, if I try to find out what my visit and my treatment or diagnostic procedures will cost me, it's a daunting task, and I need to search and my insurance web portal and
really. So you don't even know off the back of your hand.
No.
Wow.
So if the AI, what AI is good at is that we can just talk with AI. We can just ask AI, this is my condition, what is the diagnostic testing will cost me, what are the choices I have, and it can find it in real time.
Sure.
So I think it could be very, very helpful in making informed choices.
Thank you. This is very enlightening. So thanks for your time today. Anything else that we should know, just specifically around billing as a patient or AI?
I think AI has a big, tremendous promises. But at the same time, I think it's not perfect.
Sure.
And so I think in adopting AI, using AI in healthcare, we should be mindful of safety first.
Sure.
And the pitfall of AI.
I see. Making sure the human's still in the loop for now.
Yes, for sure. For a long time, I think the human needs to be in the loop.
Okay.
Especially in healthcare.
Well, thank you, Dr. Yoon, for your time. I look forward to the next one.